About the next aspect of cerebral salt wasting, which we'll get to discuss, we're actually getting to talk about the treatment. So, treatment of cerebral salt wasting. Okay. Treatment of cerebral salt wasting. Okay. So cerebral salt wasting is basically a complication in the brain that leads to you losing a lot of urine, okay, losing a lot of fluid including sodium. So it actually centers on correcting the sodium that is being lost, okay. So because sodium is being lost so much, we're having low sodiums in the body, okay. So you want to also restore the intravascular volume through sodium and fluid replacement, okay. So what are the approaches, or what are the goals, okay, and how you can solve those goals in treatment? First, you want to replace the sodium levels. So isotonic or hypertonic saline is used depending on the severity of the hyponatremia. So goal is to restore the extracellular fluid volume and correct this sodium levels, right? So frequent checks on serum sodium, urine output, fluid balance are essential. Then sodium supplementation. So all this one is basically sodium replacement. So oral sodium chloride. Then your healthcare provider will also, advise you on some foods that contain a lot of sodium so that you can take them. Mineralocorticoid therapy, so things like fludrocortisone, okay, treats underlying central nervous system issue. So it's usually coming in as a result of the central nervous system issues, you understand? So you have to actually treat those conditions, right? Have to treat those conditions, right? So neurological interventions, close neurologic monitoring is vital. So avoid fluid restriction, okay. So don't restrict fluid, which is actually one of the first things you should do in syndrome of inappropriate antidiuretic hormone secretion.